Segment for your health. We're here at Function First, and I'm here with my friend Greg. Greg, thanks so much for inviting us out.
Oh, thank you so much for coming.
So last time you were on at the studio, we talked about Redcord therapy, and it's what we're focusing on today. I'm actually going to do it today, which is a little intimidating. But before we get into the therapy, can you walk me through some of the benefits that I'll be receiving from a therapy like this?
Well, definitely. The Redcord therapy is designed to work with people of all ages, all diagnoses, all backgrounds. It's a very good therapy because it allows us to unweight the body, allows us to regress exercises that people normally wouldn't be able to do pain-free. And so we're all about doing pain-free exercises here.
So what would be some of the things that would qualify you for a therapy like this? Is it, do you have to be having lower back pain? What would be
we do treat lots of back pain when it comes to Redcord therapy because we can de-weight the whole body, but we can definitely treat shoulders, knees, hips. We treat the whole body.
And this is not a one-time thing. I mean, you can do multiple sessions of this Redcord therapy.
Oh, most definitely. I mean, you definitely can come in for an evaluation only, try to give you a pretty in-depth home exercise program. But, you know, a lot of times if the pain's been going on for a while, you kind of have to consider, you know, if the pain's been going on for a while, it's going to take at least that much time to get out of pain and to get back to where you were to restore prior level of function. So. Awesome.
So in a second, Matt is going to walk us through exactly all of the things that go into a Redcord therapy. But can you tell me a little bit more of the details? How long does a therapy like this take?
So when we do therapy here, we do 1 hour sessions with our clients. It's always one therapist with one patient. We do the whole time. Each treatment is definitely individualized for the day to see, you know, how the patient's doing and to really focus on getting to our goals.
So in just a second, we're going to come back and talk to you a little bit more whenever I wrap up my therapy, and then you can tell me some of the benefits that will be long term.
Sounds good.
Yeah, so I'm going to go change and we'll be right back.
Thank you.
Okay, so I'm ready to go. I've changed and I'm here with my friend Matt and Donald, and we're going to get started on this Redcord therapy, so I guess just walk me through it.
Okay, so when she came in today, she was complaining of some low back tightness, and so this next setting is going to basically follow her deep stabilizers to allow her back muscles to relax, okay? So I'm going to ask you to lean forward into the ropes, okay, right there. All right. I want you to breathe in with your stomach, breathe in, and I want you to push those arms forward just a little bit right there. Okay, relax, pull back. Okay, breathe in and relax. There you go. Breathe in, relax. I need you to drop your hips forward just a little bit, okay? Right there, good. Breathe in and relax. Feel the lower back starting to relax a little bit. When you breathe out, breathe in. Pull the arms down just a little bit. Bend the elbows. There you go. A lot of work does this. Breathe in and relax. There you go. Feel starting to relax?
Yes.
Breathe in and relax. And a lot of times patients come in and they have a lot of back tightness, and so, you know, they may have knee pain, but if their back is tight, it's going to be hard for the body to be efficient. And so when you're trying to move them out of pain, you really have to target the core, basically.
So is my lower back pretty tight?
Yes, it's pretty tight. Okay, breathe in. But it is relaxing, and relax. There you go. Breathe in and relax. There you go. Okay, pull back into kneeling. Pull, pull, pull. Okay. All right, try to move around a little bit.
Okay.
Okay. All right, we're gonna do one more lean. Lean forward.
Okay.
Okay. Right there. Hold it. Breathe in. Fire that core. Breathe in. Pull that. Bend the elbows a little bit. Forward.
Hips into that sling.
There you go. Good. Relax. There you go. Breathe in. Good. Breathe in. And relax. Pull back into the kneeling. All right. Okay. All right.
A little dizzy.
Yeah, a little dizzy.
That's what's happening?
Well,
with
the deep breathing, when you start to relax, it starts to open up the blood vessels.
Okay.
And so you start to get an increased blood flow to that low back.
Okay.
Okay. All right. We previously just fired her deep core muscles, and so now she's ready for what we call myofascial chain exercises, which means we're going to fire her posterior leg muscles to basically help correct the pelvic alignment, so she doesn't go into quite as much low doses and the back doesn't tighten back up. Okay. All right. What you can do? Can you lift your hips up for us? Okay. Put your hands by your side. Keep pressure into the pillow. Okay. Now I want you to bend one knee at a time. Bend one knee. Keep your hips up while you bend. Good. And back out. Bend the other knee. Okay. Very good. All right. Now can you bend both at the same time while you keep your hips up? Bend, 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 bend. Now straighten back out. Good. Okay, bend, bend, bend. Hold it. Bend, 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 bend.
Maybe I'm not in shape.
Keep those hips up higher. There you go. Bend both knees. Both. All right. Good. Bend. Okay. Get a little shake.
What is happening?
Okay.
Are you making it harder for me?
We're shaking the ropes to actually help you out. Because when you provide any kind of vibration or perturbation, it'll actually increase muscle activation. So, bend, bend, bend. Good. Bend. All right. Straighten those legs and lower it down. Take a little break. Okay. All right.
Oof. Definitely felt that. And my hamstrings.
Exercise a lot, but they don't necessarily target the muscle specifically.
Okay.
And so with the system, we actually are focusing on targeting the muscles in a more specific pattern, rather than doing, a squat or a lunge, things like that. Okay. All right, take these down. All right, fam. You can sit up nice and easy. Okay.
We're done here?
Yes.
All right, so we're going to go chat now and talk about the benefits of this Redcord therapy. Let's go. So Donald, we just wrapped up Redcord therapy. Talk to me a little bit about the benefits that I'll be receiving and sort of the change that I'll see from what we worked on today.
Okay, so the great thing about Redcord is we're not necessarily focusing on strengthening the muscles. It's more what we call an activation. Mm-hmm. And so what we did there was we did a kneeling activation for the lumbar spine.
Okay.
And then we followed up with a hamstring activation to kind of help hold the pelvis where we want it, so your back doesn't go into quite as much low doses, so those big muscles on the sides don't tighten up quite as much.
Yeah.
And so the idea is that rather than focusing on strengthening or stretching, we're activating it so your body will hold them in the proper position.
Okay.
And so if you do that repeatedly, you should start to see a carryover effect within just a couple of visits.
Awesome. Yeah, even just from that one session, I felt like I felt a little looser, just more relaxed. So yeah, and my hamstrings were definitely burning a little bit. So I think that's a good thing, right?
That's right.
So Donald, remind us where you're located and where people can come and receive this Redcord therapy.
We're located on Fern Avenue in Shreveport, 7607, Suite 704. You can find us on Facebook at Function First LA, and our website is functionfirstla.com.
Awesome. Well, thank you so much for having us. I'll see you next time. So if you're experiencing some back trouble, come see our friends here at Function First. They're ready to help you with your back problems.